Question 1. A registered practical nurse, RPN, is caring for a client newly diagnosed with type 2 diabetes mellitus. The client expresses significant anxiety about managing their blood sugar levels at home. Which initial action by the RPN is most appropriate? A. Refer the client immediately to a dietitian for meal planning. B. Provide the client with a detailed pamphlet about diabetes management. C. Assess the client's current understanding of diabetes and their learning readiness. D. Administer a sedative medication to reduce the client's anxiety. Answer: C. Assess the client's current understanding of diabetes and their learning readiness. This question tests the RPN's role in client education and assessment, emphasizing the importance of a client-centered approach. The keywords newly diagnosed and significant anxiety highlight that the client is likely overwhelmed and may have limited knowledge, making assessment crucial before intervention. Before providing education or referrals, an RPN must first understand what the client already knows, what they misunderstand, and their emotional state to ensure teaching is effective and tailored. For example, if a client believes they can never eat sugar again, clarifying this misconception is more beneficial than general information. Always begin by assessing the client's foundation of knowledge and their readiness to learn, as this ensures teaching is relevant and absorbed. Question 2. An RPN is assisting with the care of a client who is 2 days post-operative following a total hip arthroplasty. The client reports sudden, sharp chest pain and dyspnea. The RPN notes a drop in oxygen saturation to 88% and an increased respiratory rate. What is the RPN's priority action? A. Administer the prescribed PRN pain medication. B. Assist the client to a comfortable position and apply oxygen. C. Document the findings thoroughly in the client's chart. D. Notify the client's family about the change in condition. Answer: B. Assist the client to a comfortable position and apply oxygen. This question evaluates the RPN's ability to prioritize based on the ABCs, airway, breathing, circulation, and recognize signs of acute respiratory distress, which is a critical skill. The keywords sudden, sharp chest pain, dyspnea, and drop in oxygen saturation to 88% strongly suggest a potential pulmonary embolism or other serious respiratory compromise requiring immediate intervention. Providing oxygen and positioning the client to ease breathing are vital initial steps to stabilize the client's respiratory status before notifying the physician or documenting. For instance, addressing immediate physiological needs like breathing always takes precedence over pain relief or notification of family. Always prioritize actions that directly support life-sustaining functions like breathing when a client's oxygen levels are compromised. Question 3. An RPN is preparing to administer medication to an older adult client with impaired hearing. The client uses hearing aids, but they are currently not in place. To ensure effective communication and client safety during medication administration, what should the RPN do? A. Speak loudly and slowly, repeating the medication names multiple times. B. Administer the medication without explanation, as the client may not hear it anyway. C. Ensure the client's hearing aids are in place and functioning before providing explanations. D. Write down all medication information on a whiteboard for the client to read. Answer: C. Ensure the client's hearing aids are in place and functioning before providing explanations. This question assesses the RPN's understanding of effective communication strategies, particularly with clients who have sensory deficits, and its direct link to client safety in medication administration. The keyword impaired hearing and the detail that hearing aids are currently not in place are crucial clues indicating that the primary barrier to communication is the client's hearing. Ensuring the client can fully hear and understand information about their medication is fundamental for informed consent and safety, making the proper use of their aids essential. For example, a client needs to hear and confirm their identity and the medication being given to prevent errors. Remember that optimizing a client's sensory aids is the first step to effective verbal communication and promoting client safety. Question 4. An RPN is caring for a client receiving continuous intravenous fluid therapy. The RPN notices swelling and coolness at the insertion site, and the client reports discomfort. What is the most appropriate initial nursing action? A. Increase the drip rate to flush the line. B. Apply a warm compress to the site to reduce swelling. C. Discontinue the infusion immediately and remove the catheter. D. Document the findings and monitor the site closely for improvement. Answer: C. Discontinue the infusion immediately and remove the catheter. This question evaluates the RPN's knowledge of identifying and managing complications, specifically infiltration. The keywords swelling and coolness at the insertion site, combined with client reports discomfort, are classic signs of infiltration, where fluid leaks into the surrounding tissue. The most appropriate initial action is to stop the fluid from infusing into the tissue, which means discontinuing the and removing the catheter to prevent further fluid accumulation and potential tissue damage. For instance, continuing the infusion or attempting to flush it would worsen the infiltration. Always remember that signs of infiltration require immediate discontinuation of the to prevent further complications. Question 5. An RPN is reviewing a new client's chart and notes that the client has a Do Not Resuscitate (DNR) order in place. During the admission assessment, the client's family member asks the RPN, "What exactly does DNR mean for my loved one?" What is the most appropriate response by the RPN? A. It means we will provide comfort care only, and no medical interventions. B. It means that in the event of cardiac or respiratory arrest, CPR will not be initiated. C. It means the client will not receive any further medical treatment for their condition. D. You should discuss this with the doctor. I cannot explain medical orders. Answer: B. It means that in the event of cardiac or respiratory arrest, CPR will not be initiated. This question assesses the RPN's understanding of end-of-life care directives and effective communication with clients and families about sensitive topics. The keyword Do Not Resuscitate (DNR) specifically refers to the decision not to perform cardiopulmonary resuscitation (CPR) in the event of cardiac or respiratory arrest. It does not mean withholding all other medical treatments or providing only comfort care, which are common misconceptions. Providing a clear and accurate explanation empowers the family with correct information and respects the client's wishes. For example, a client with a DNR order may still receive antibiotics for an infection or pain medication. Always clarify the specific meaning of medical orders like DNR to ensure families understand the scope and limitations. Question 6. An RPN is providing care for a client who is confused and at high risk for falls. The RPN finds the client attempting to climb over the bed rails. The nurse's immediate priority is to ensure client safety. What is the most appropriate action for the RPN? A. Apply a vest restraint to the client immediately. B. Lower the bed, place a fall mat on the floor, and engage the client in an activity. C. Administer a PRN sedative to the client as ordered. D. Instruct the client firmly to stay in bed and call for help. Answer: B. Lower the bed, place a fall mat on the floor, and engage the client in an activity. This question focuses on fall prevention strategies and prioritizing client safety while adhering to least restrictive interventions, a key principle in nursing care. The keywords confused, high risk for falls, and attempting to climb over the bed rails highlight an immediate safety concern. The most appropriate action is to implement non-restrictive fall prevention measures first, such as lowering the bed and using a fall mat, which directly reduces the risk of injury from a fall, while also attempting to reorient or distract the client to prevent further attempts. For instance, using restraints should be a last resort after other less restrictive measures have been tried or deemed ineffective. Always prioritize non-pharmacological and least restrictive interventions to maintain client safety and dignity. Question 7. An RPN is reviewing the medication administration record, MAR, for a client prescribed digoxin. The RPN notes the client's apical pulse is 52 beats per minute. What is the most appropriate action by the RPN? A. Administer the digoxin as scheduled. B. Hold the digoxin and recheck the apical pulse in 30 minutes. C. Hold the digoxin and notify the physician. D. Administer half of the prescribed digoxin dose. Answer: C. Hold the digoxin and notify the physician. This question assesses the RPN's knowledge of medication safety, specifically related to digoxin administration and its effects on heart rate. The keyword digoxin is a cardiac glycoside known to decrease heart rate, and an apical pulse below 60 beats per minute is a critical parameter for its safe administration. An apical pulse of 52 beats per minute is below the safe threshold, indicating that administering the medication could dangerously lower the heart rate further. Therefore, the most appropriate action is to withhold the dose and immediately inform the physician for further orders. For example, giving digoxin when the pulse is too low could lead to symptomatic bradycardia or other cardiac dysrhythmias. Always prioritize client safety by withholding medications when parameters indicate potential harm and consulting with the physician. Question 8. An RPN is caring for a client with a new colostomy. The client is visibly upset and states, "I don't know how I'm going to live with this. My life is over." What is the most therapeutic response by the RPN? A. Don't worry, thousands of people live normal lives with a colostomy. B. You'll get used to it. It just takes time. C. It sounds like you're feeling overwhelmed and concerned about your life changes. D. Let's focus on learning how to care for your stoma first. Answer: C. It sounds like you're feeling overwhelmed and concerned about your life changes. This question tests the RPN's ability to use therapeutic communication techniques, particularly active listening and empathy, when a client expresses distress. The keywords "visibly upset" and "my life is over" indicate a deep emotional response and a sense of loss and despair. A therapeutic response acknowledges the client's feelings and validates their experience, rather than minimizing or dismissing them. Reflecting their feelings, such as "it sounds like you're feeling overwhelmed and concerned about your life changes," opens the door for further discussion and allows the client to feel heard and understood. For example, telling someone not to worry can invalidate their feelings. Always prioritize validating a client's expressed emotions before attempting to educate or problem solve, as this builds trust and encourages open communication. Question 9. An RPN is preparing to ambulate a client for the first time after a stroke, who presents with left-sided weakness. What is the most important safety consideration for the RPN to implement? A. Have another staff member present to assist. B. Encourage the client to use their unaffected side for support. C. Use a gait belt around the client's waist and walk slightly behind and to the side of the client. D. Ambulate the client only a short distance, such as to the bedside commode. Answer: C. Use a gait belt around the client's waist and walk slightly behind and to the side of the client. This question focuses on safe client ambulation, especially for clients with motor deficits, and highlights the specific use of assistive devices for safety. The keywords "first time after a stroke" and "left-sided weakness" indicate that the client has impaired balance and strength, increasing their fall risk during ambulation. The most important safety consideration is using a gait belt, which allows the RPN to safely support the client if they lose their balance, while walking slightly behind and to the client's weaker side provides optimal support and control. For instance, relying only on verbal encouragement or just having another person without direct physical support is less effective in preventing a sudden fall. Always prioritize the use of appropriate assistive devices and proper body mechanics to ensure client safety during ambulation, especially with clients who have motor deficits. Question 10. An RPN is monitoring a client with an indwelling urinary catheter. The RPN notes that there has been no urine output for the past 3 hours, despite adequate fluid intake. What is the RPN's initial action? A. Remove the indwelling catheter immediately. B. Notify the physician about the lack of urine output. C. Check for kinks or obstructions in the tubing. D. Increase the client's fluid intake to promote urine production. Answer: C. Check for kinks or obstructions in the tubing. This question assesses the RPN's problem-solving skills related to urinary catheter management and identification of common issues. The keywords "no urine output for the past 3 hours" and "adequate fluid intake" suggest an issue with urine drainage rather than production, and a mechanical obstruction is a common cause. The initial and simplest action is to troubleshoot the equipment by checking for kinks in the tubing, dependent loops, or blockages, as these are easily reversible causes of absent output. For example, a client could have normal kidney function and urine production, but if the catheter tubing is kinked, the urine cannot drain into the bag. Always troubleshoot the equipment first when there's an absence of expected output from a drainage device, as it's often the quickest resolution. Question 11. An RPN is providing discharge teaching to a client diagnosed with heart failure about managing their condition at home. Which instruction is most important for the RPN to emphasize to prevent exacerbations? A. Weigh yourself daily and report a gain of 2 pounds, 1 kilogram, or more in a day. B. Limit your physical activity to avoid straining your heart. C. Take your diuretics only when you feel swollen. D. Eat a high-protein diet to strengthen your muscles. Answer: A. Weigh yourself daily and report a gain of 2 pounds, 1 kilogram, or more in a day. This question focuses on client education for chronic disease management, specifically heart failure, and identifying critical signs of worsening condition. The keyword heart failure implies a compromised cardiac pump that is susceptible to fluid overload. Daily weight monitoring is a crucial early indicator of fluid retention, which can quickly lead to an exacerbation of heart failure symptoms like shortness of breath and swelling. Prompt reporting of a significant weight gain allows for timely intervention to prevent acute decompensation. For example, a sudden weight gain could indicate the body is retaining too much fluid, putting extra strain on the heart. Emphasizing daily weight checks is paramount for early detection of fluid retention and prompt intervention, which is key to preventing heart failure exacerbations. Question 12. An RPN is caring for a client who is NPO, nothing by mouth, for surgery. The client reports extreme thirst and asks for a glass of water. What is the most appropriate response by the RPN? A. I know you're thirsty, but I cannot give you water because of your surgery. B. You can have a small sip of water, but don't drink the whole glass. C. I will get you some ice chips, which are allowed when NPO. D. Drinking water before surgery could make you vomit and cause complications. Answer: A. I know you're thirsty, but I cannot give you water because of your surgery. This question assesses the RPN's understanding of NPO status protocols for surgery and the importance of clear, empathetic communication. The keyword NPO for surgery indicates a strict order where no oral intake is permitted to prevent aspiration risks during anesthesia or surgery. While empathy for the client's thirst is important, providing water, even a small sip, would violate the order and pose a significant safety risk. The most appropriate response clearly states the restriction while acknowledging the client's discomfort. For instance, giving a client water when NPO for surgery can lead to serious respiratory complications if they vomit and aspirate during the procedure. Always adhere strictly to NPO orders for client safety, explaining the rationale clearly and empathetically. Question 13. An RPN is assisting a client with advanced dementia with activities of daily living, ADLs. The client becomes agitated and resistant during personal care. What is the most effective approach for the RPN to take? A. Insist on completing the ADLs quickly to avoid prolonged agitation. B. Leave the client alone until the agitation subsides. C. Use a calm voice, simplify instructions, and offer choices when possible. D. Administer a PRN sedative to reduce the client's agitation. Answer: C. Use a calm voice, simplify instructions, and offer choices when possible. This question explores the RPN's ability to manage challenging behaviors in clients with dementia using therapeutic and person-centered approaches. The keywords advanced dementia, agitated, and resistant during personal care indicate that the client may be experiencing confusion, fear, or discomfort due to their cognitive impairment. The most effective approach involves using a calm, reassuring tone, breaking down tasks into simple steps, and offering limited choices to give the client a sense of control and reduce their resistance. For example, instead of saying, "Take a shower," you might say, "Would you like to wash your arms first or your face?" Always prioritize non-pharmacological, person-centered strategies that reduce client distress and promote cooperation. Question 14. An RPN is providing wound care for a client with a non-healing pressure injury on the sacrum. The wound has a strong foul odor and purulent drainage. Which type of dressing would the RPN anticipate is most appropriate? A. Transparent film dressing. B. Hydrocolloid dressing. C. Alginate or foam dressing with an antimicrobial agent. D. Dry gauze dressing. Answer: C. Alginate or foam dressing with an antimicrobial agent. This question assesses the RPN's knowledge of wound care principles, specifically selecting appropriate dressings for infected wounds. The keywords non-healing pressure injury, strong foul odor, and purulent drainage are classic signs of a wound infection, requiring a dressing that can manage exudate and potentially deliver an antimicrobial agent. Alginate or foam dressings are highly absorbent, managing the purulent drainage, while an embedded antimicrobial agent helps address the infection and the foul odor. For example, a dry gauze would not manage the drainage, and transparent film or hydrocolloid dressings would trap bacteria and moisture, worsening the infection. Always choose a dressing that addresses the specific characteristics of the wound, especially signs of infection, to promote healing and manage symptoms. Question 15. An RPN is caring for a client with newly diagnosed delirium. The client is disoriented, restless, and attempting to pull out their foreline. What is the most appropriate nursing intervention to manage the client's behavior? A. Apply wrist restraints to prevent removal of the fore. B. Increase lighting in the room to reorient the client. C. Provide a quiet, well-lit environment and frequently reorient the client. D. Administer a sedating medication as the first line of intervention. Answer: C. Provide a quiet, well-lit environment and frequently reorient the client. This question evaluates the RPN's understanding of managing delirium, emphasizing non-pharmacological interventions and a safe environment. The keywords newly diagnosed delirium, disoriented, restless, and attempting to pull out their foreline describe a client who is acutely confused and agitated, requiring immediate intervention for safety. The most appropriate initial intervention is to create a calm, consistent, and well-structured environment while frequently reorienting the client, as this helps reduce agitation and confusion. For instance, restraints should be a last resort, and sedatives can worsen delirium. Always prioritize environmental modifications and frequent reorientation to manage delirium before resorting to physical restraints or pharmacological interventions. Question 16. An RPN is reinforcing teaching with a client who has recently started taking an ACE inhibitor for hypertension. Which statement by the client indicates a need for further teaching? A. I know I need to avoid potassium-rich foods like bananas. B. I should report any swelling in my lips or tongue immediately. C. I might develop a dry cough while taking this medication. D. I need to take my blood pressure regularly at home. Answer: A. I know I need to avoid potassium-rich foods like bananas. This question assesses the RPN's knowledge of client teaching related to ACE inhibitors and their potential side effects. The concept being tested is understanding common adverse effects and interactions with ACE inhibitors. The keyword ACE inhibitor is crucial because these medications can cause hyperkalemia, high potassium levels, as a side effect, meaning clients should be cautious with potassium, but typically not avoid it unless specifically instructed due to pre-existing conditions or other medications. Therefore, stating they need to avoid potassium-rich foods indicates a misunderstanding. Other options correctly identify common side effects: cough, serious adverse effects, angioedema, and necessary monitoring. For example, while potassium levels should be monitored, complete avoidance of healthy, potassium-rich foods is generally not required unless specifically ordered by the physician. Ensure clients understand the balance of dietary modifications and medication effects to prevent unnecessary restrictions. Question 17. An RPN is caring for a client with a tracheostomy who has copious, thick secretions. The RPN prepares to perform tracheostomy suctioning. What is the most critical intervention to perform before initiating suctioning? A. Administer a bronchodilator medication. B. Auscultate lung sounds thoroughly. C. Pre-oxygenate the client with 100% oxygen. D. Obtain a sputum culture specimen. Answer: C. Pre-oxygenate the client with 100% oxygen. This question assesses the RPN's knowledge of safe tracheostomy care, specifically the critical steps involved in suctioning to prevent complications. The keywords tracheostomy and suctioning indicate a procedure that can temporarily decrease a client's oxygen levels. Pre-oxygenating the client with 100% oxygen for 30 to 60 seconds before inserting the suction catheter is the most critical intervention to minimize the risk of hypoxemia, low oxygen in the blood, during the procedure. For example, suctioning removes air along with secretions, which can quickly drop a client's oxygen levels, especially if they are already compromised. Always prioritize pre-oxygenation before any suctioning procedure to maintain adequate oxygen saturation and prevent adverse events. Question 18. An RPN is reinforcing education about safe food handling to a client with a compromised immune system. Which statement by the client indicates a correct understanding of the teaching? A. I can eat raw fruits and vegetables if I wash them thoroughly. B. I should always cook my meat until it is well done. C. It's safe to eat deli meats if they are packaged well. D. I can drink unpasteurized milk since it's natural. Answer: B. I should always cook my meat until it is well done. This question evaluates the RPN's understanding of food safety guidelines for immunocompromised clients who are at a higher risk of foodborne illnesses. The keyword compromised immune system is a critical clue, indicating that the client needs stricter food safety measures than the general population. Cooking meat well done ensures that potential bacteria like Salmonella or E. coli are destroyed, significantly reducing the risk of infection. Raw fruits/vegetables, even washed, deli meats, and unpasteurized milk can harbor harmful pathogens and are generally not recommended for immunocompromised individuals. For example, Undercooked meat can cause severe food poisoning in someone whose immune system cannot fight off common bacteria. Always emphasize thorough cooking of meats and avoidance of high-risk foods for clients with compromised immune systems to prevent serious infections. Question 19. An RPN is assisting with the care of a client who has just received a blood transfusion. 30 minutes into the transfusion, the client reports feeling itchy all over and develops hives. What is the RPN's immediate action? A. Slow down the transfusion rate and monitor. B. Stop the transfusion immediately. C. Administer an antihistamine as prescribed. D. Recheck the client's vital signs and the blood product label. Answer: B. Stop the transfusion immediately. This question tests the RPN's ability to recognize and respond to an acute transfusion reaction, prioritizing client safety. The keywords itchy all over and hives developing 30 minutes into the transfusion are classic signs of an allergic or mild transfusion reaction. The immediate and most crucial action is to stop the transfusion to prevent further exposure to the reacting agent and halt the progression of the reaction. While vital signs, rechecking labels, and administering medications are important subsequent steps, stopping the infusion takes precedence to ensure client safety. For example, continuing the transfusion would worsen the allergic reaction and potentially lead to more severe complications. Always prioritize immediately stopping a blood transfusion at the first sign of a reaction to prevent further harm. Question 20. An RPN is providing care to a client who frequently experiences episodes of orthostatic hypotension. To prevent falls, which instruction should the RPN give to the client? A. Get out of bed quickly in the morning to get your circulation going. B. Make sure to stand up slowly from a lying or sitting position. C. Limit your fluid intake to prevent fluid shifts. D. Avoid taking your blood pressure medication in the morning. Answer: B. Make sure to stand up slowly from a lying or sitting position. This question assesses the RPN's understanding of orthostatic hypotension and practical fall prevention strategies. The keyword orthostatic hypotension refers to a sudden drop in blood pressure upon standing, which can cause dizziness, lightheadedness, and increase the risk of falls. The most effective instruction to prevent this is to advise the client to change positions slowly, allowing the body time to adjust blood pressure. For example, moving from lying to sitting, pausing, and then slowly standing allows the cardiovascular system to compensate, reducing the sudden drop in blood pressure. Always emphasize slow position changes for clients experiencing orthostatic hypotension to minimize dizziness and prevent falls. Question 21. An RPN is discussing pain management options with a client who has chronic back pain. The client expresses concern about taking opioid medications due to fear of addiction. What is the most appropriate response by the RPN? A. Don't worry, addiction is rare when opioids are prescribed for pain. B. Opioids are the only effective treatment for chronic pain, you'll have to take them. C. Let's discuss non-opioid pain relief options and strategies to manage your pain. D. You can just take them when the pain is really severe, not every day. Answer: C. Let's discuss non-opioid pain relief options and strategies to manage your pain. This question tests the RPN's ability to engage in client-centered care and provide comprehensive pain management options, addressing client concerns. The keywords chronic back pain and fear of addiction highlight the client's specific concern about opioid use. The most appropriate response is to acknowledge their concern and offer to explore alternative or complementary non-opioid pain relief strategies, which respects the client's autonomy and addresses their fears. For example, discussing physical therapy, heat/cold therapy, or over-the-counter pain relievers can empower the client to participate in their pain management without relying solely on opioids. Always explore a range of pain management options and address client concerns openly to promote adherence and trust. Question 22. An RPN is assisting a client with ambulation who suddenly reports feeling dizzy and lightheaded. The RPN notes the client's knees beginning to buckle. What is the RPN's immediate action? A. Call for help immediately while holding the client steady. B. Lower the client gently to the floor. C. Attempt to walk the client back to their room quickly. D. Encourage the client to take deep breaths. Answer: B. Lower the client gently to the floor. This question assesses the RPN's ability to manage an imminent fall scenario, prioritizing client safety. The keywords "suddenly reports feeling dizzy and lightheaded" and "knees beginning to buckle" indicate that a fall is unavoidable. The most appropriate immediate action is to safely lower the client to the floor, controlling the fall to minimize the impact and potential for serious injury, rather than attempting to prevent it entirely once it has started. For example, trying to walk the client back to their room would put both the client and the RPN at greater risk of injury. Always prioritize safely lowering a client to the floor at the first sign of an uncontrolled fall to prevent injury. Question 23. An RPN is caring for a client with a nasogastric (NG) tube inserted for gastric decompression. The client complains of abdominal cramping and nausea. The RPN assesses that there is no drainage in the suction canister. What is the most appropriate initial nursing action? A. Increase the suction pressure on the NG tube. B. Administer an antiemetic medication. C. Irrigate the NG tube with normal saline as per physician order. D. Reposition the client and check the tube for kinks. Answer: D. Reposition the client and check the tube for kinks. This question evaluates the RPN's problem-solving skills related to common issues with nasogastric tube management. The keywords abdominal cramping and nausea in a client with an NG tube for gastric decompression and no drainage suggest an obstruction in the tube. The most appropriate initial action is to troubleshoot for mechanical issues like kinks or improper positioning, which can prevent drainage. Repositioning the client or gently repositioning the tube can often resolve these issues, allowing the tube to function effectively. For example, if the tube is kinked or pressing against the stomach wall, simply adjusting the client's position or the tube's position can re-establish drainage. Always check for mechanical obstructions first when an NG tube is not draining as expected. Question 24. An RPN is assisting a new mother with breastfeeding. The mother expresses concern that her baby is not getting enough milk, as the baby is frequently crying and seems unsatisfied after feeds. What is the most important assessment the RPN should perform to evaluate the baby's intake? A. Observe the baby's feeding technique and latch. B. Ask the mother about her diet and fluid intake. C. Weigh the baby before and after each feeding. D. Check the number of wet diapers and stools in 24 hours. Answer: D. Check the number of wet diapers and stools in 24 hours. This question assesses the RPN's knowledge of evaluating adequate milk intake in a breastfed infant, a common concern for new mothers. The keywords frequently crying and seems unsatisfied indicate potential insufficient feeding. While observing latch is important for effective feeding, the most objective and practical assessment for actual intake in a home setting or clinic is checking the number of wet diapers, typically 6 to 8 in 24 hours after day 4, and stools, 3 to 4 or more mustard yellow stools in 24 hours, These indicate that the baby is receiving and processing adequate fluids and nutrients. For example, a baby with sufficient intake will have consistent wet and soiled diapers, regardless of how long they feed. Always prioritize objective measures like diaper output to confirm adequate milk intake in breastfed infants, as this provides concrete evidence of hydration and nutrition. Question 25. An RPN is preparing to administer medications to a client. The RPN scans the client's wristband, and the medication administration system alerts wrong client. What is the RPN's immediate priority action? A. Override the alert and proceed with administration if the client states their name matches. B. Stop immediately and re-verify the client's identity using two identifiers and the MAR. C. Call the pharmacist to confirm the medication order. D. Document the system alert and continue with other clients' medications. Answer: B. Stop immediately and re-verify the client's identity using two identifiers and the MAR. This question assesses the RPN's critical thinking and adherence to medication safety protocols, specifically the rights of medication administration and technology alerts. The keyword wrong client from the medication administration system is a critical safety alert that must be addressed immediately. The RPN's absolute priority is to stop the process and re-verify the client's identity using at least two independent identifiers, e.g., full name and date of birth, and comparing them against the medication administration record, MAR. For example, ignoring such an alert could lead to a severe medication error, administering the wrong medication to the wrong person. Always prioritize client safety by immediately halting medication administration and performing a thorough identity verification whenever a wrong client alert appears.